Let's talk about skilled nursing facilities, or SNFs. You know, every single time a new patient comes through the door, everything kicks off with one critical first step: verifying their insurance. Now, that sounds easy enough, right? But it's actually this incredibly complex process. Kind of feels like running a gauntlet. So today, we're going to break down how it all works, why it gets so messy, and how technology is stepping in to change the game. And really, it all boils down to this one question. It seems so simple on the surface, but the answer? Wow, it determines everything that happens next. We're talking about the patient's course of care, of course, but also the financial stability of the entire facility. It's a huge, high-stakes moment that could really set the stage for either success or failure. You see, confirming eligibility isn't just some box-ticking exercise or administrative paperwork. No, this is the absolute foundation. It's what confirms whether a resident's services will actually be covered, and, this is the big one, if the SNF is going to get paid for all the care they're about to provide. And here's why it's so critical. Just one tiny mistake in this process, I'm talking something as small as an outdated plan, a typo in the member ID, or a missed authorization, any one of those can lead straight to a denied claim. And a denied claim means the facility does all the work, provides all the care, and then gets nothing, zero payment. That's just the reality of it. Every single gap in information, every little mistake in verification puts the skilled nursing facility in a really tough spot financially. And that risk directly impacts their ability to operate effectively and, give the consistent care that patients need. Okay, so how are most places actually doing this today? Well, for many, it's a mess. It's this chaotic, super inefficient maze of manual tasks. You can just imagine what that's like for the admissions teams trying to sort through it all. Think about it. For just one patient, the admissions coordinator is trying to piece together a puzzle, and the pieces are everywhere. They're logging into a bunch of different insurance websites, they're on the phone with insurers, they're digging through faxes, all while trying to make sense of the discharge papers from the hospital. It's a total juggle. And what are they hunting for in all that chaos? A huge checklist of details. For every single person, they have to confirm, is the coverage even active? Is this member ID right? What kind of plan are we dealing with? Medicare, Medicaid, a managed care plan? How many skilled days are left? Are authorizations needed? And hey, is there a secondary insurance we need to know about? And the craziest part, they have to do all of this by hand, usually with the clock ticking. And here's a classic nightmare for admissions staff. The info they get from the hospital, well, it often doesn't match what the insurance company has on file. You've got these two different versions of the truth, right? And that mismatch just creates a ton of confusion and can cause huge errors later on. It basically starts the whole admission off on completely the wrong foot. So all of this leads to some pretty common and super frustrating roadblocks. You log into the insurance portal and surprise, the data is incomplete. Or you're stuck on hold with an insurer for what feels like an eternity. And don't even get me started on how every different plan seems to have its own secret set of rules. It all just adds up to delays, mistakes, and honestly, a lot of staff burnout. But what if you could just get rid of all that manual chaos and get some automated clarity instead? Well, this is where automation really becomes a game changer. It's a solution that can completely transform this repetitive, error-prone mess. Let's just walk through what that looks like in practice. A referral comes in, the system just grabs the patient's info automatically. Then, boom, it instantly checks all the different payer portals, verifies all those key details we were just talking about, and hands the staff a nice, clean, easy-to-read summary. It is a night and day difference. I mean, the impact on efficiency is just staggering. A task that usually takes someone anywhere from 20 to 40 minutes per patient is suddenly done in a matter of seconds. Just think about that. Multiply that time saved across every single admission they handle. And it's not just about speed, it's also about being smarter. An automated system can instantly find those critical problems that are so easy for a human to miss. Things like, oh, the coverage was actually terminated, or here's the exact number of skilled days left, or hey, this plan has a hidden authorization requirement you need to know about. It flags all these issues right away before they mess up billing or disrupt a patient's care. And the cool thing is, the benefits of getting this right at the very beginning don't just stop with the admissions team. It creates this awesome positive ripple effect that you can feel across the entire facility. You can really see the transformation everywhere. For the admissions folks, all that stress and guesswork, gone, replaced with speed and confidence. For the billing office, the endless cycle of denials and delays turns into clean claims and a healthy cash flow. And for the clinical team, they can focus on providing smooth, uninterrupted care without worrying if a coverage issue is going to pop up. So what are the big wins here? Well, it's pretty clear. Facilities see way fewer claim denials, they can get patients admitted faster and with a lot more confidence, staff can actually get more done, and all of this strengthens the financial health of the whole organization. All of this really brings us to a big conclusion. In today's super complex healthcare world, automation isn't some fancy luxury item. It's a necessary evolution. The old way of doing things by hand, it just can't keep up anymore. I mean, think about it. The rules for getting paid just keep getting more and more complicated. So having accurate, automated eligibility checks isn't just a nice-to-have feature. It's the absolute bedrock for any SNF that wants to be financially stable and successful. And that really brings us full circle, back to what matters most. It forces every single facility to ask itself a really tough question. Is our old, outdated manual process just hurting our bottom line, or is it actually putting our patients' care at risk too?